agree.
Impact segment tonight, the Democratic Party feeling pretty good, while the Republicans, well, we don't exactly know what they're thinking, but we'll find out. First up, Congressman Brad Sherman, a Democrat from California. The worst part about this for me is the fiscal stuff, and you being from California, you know the horror that your state's going through right now. It could get worse. And I'm just really worried. I'm not buying the CBO numbers. I don't like the Social Security, the payroll tax being raided to pay for this. I don't believe they're going to get $500 billion out of Medicare. I just don't believe it. I could be wrong, Congressman. I could absolutely be wrong on this. It's just a gut thing. But does not enter into your thinking at all that this could be a fiscal disaster?
When it comes to fiscal projections, I don't rely on my gut. I'd rather rely on the CBO. The present system could explode downward. You see more and more people losing their coverage. They could end up on Medicaid, especially if they have a diagnosis. That first operation takes away their own assets, and then they're eligible for Medicaid. So I think the worst thing we could do from our fiscal system is to leave the law alone and watch as more and more people lose coverage, or there are caps on coverage, throwing more and more people on Medicaid. CBO, much more trustworthy, at least than my gut, shows $143 billion savings in the first 10 years and $1.2 trillion the second 10 years. That's not because of magic. That's because this bill includes a major tax increase on
I know, but they're taking money
wealthy.
from Peter to Rob Paul. But here's what, and I think you heard Sarah Palin's interview. The governor said, look, I don't think anybody disputes, no fair-minded people do, that we have to get insurance companies to be more humane, that you can't be throwing people off when they get sick, can't be denying people coverage on a pre-existing that's just not crazy. You know, if somebody comes in with leprosy and their thumb falls off on your desk, okay, you might have a problem. But what the governor says, what targeted reform to the insurance companies or any other abuses would have been fine with her and most Republicans. But this dramatic expansion of the federal government into this area, when it is a gamble, look, I know you're a loyal Democrat. I know you believe what you say. But it is a gamble, Congressman. It is a gamble with the nation's future. It could go south. You know it could.
Well, going with the present system is a gamble with the odds against us, because your Blue Cross card is shrinking. People are being charged more by their employer is charging more, the deductibles are going up, and now you have these lifetime caps. So if you're healthy, fine, you're diagnosed with cancer, you get the first operation paid for. After that, you're on your death panel time. The fact is that you cannot prohibit pre-existing conditions unless you also have a requirement of universal coverage. Otherwise, people will, as long as they're healthy and they're fighting to deal with other bills, they won't buy the health
and
insurance
they'll come on,
until the diagnosis.
But there are ways.
So that's why you need universal coverage.
There are ways that you can target that, though. But anyway, look, I don't want to debate the bill. The bill, you guys won. It passed. You got it.
Let's see if we can pass the reconciliation bill. That's going to be the hard part. That goes over to the Senate.
It doesn't really matter, because as soon as you pass the Senate version, it's going to go up and the president's going to sign it. So we're going to have some form of quasi-socialized medicine. Now, the unintended consequences of that, to me, and again, I'm looking out forward, is that it creates a bigger entitlement society. I'm sure you know, because you're very eloquent on the issue, that 60% of those receiving Obamacare uninsured are going to be subsidized by me and you and other people. This just heightens our entitlement society. It brings us up into the Western European model, and obviously most Americans don't want that, according to the polls. What say you?
Right now, people without coverage are subsidized by you and me through a hidden subsidy, and that's called unreimbursed coverage. They go to the emergency room, the least efficient place for them to get care.
But the numbers aren't
nearly
you're paying for it. Yeah, but the numbers aren't nearly as big as all of the people coming on the rolls. And it's the entitlement. Look, if it were me and I were president, the people who go into the emergency rooms would give their Social Security card, and then they'd be debited if they ever made any money against the expense. So I wouldn't allow the free ride anywhere, because the entitlement society, I think, erodes our power. It erodes the power of the United States. But the Democratic Party doesn't see it that way.
Well, the fact is we do have a bankruptcy law, and most people without coverage are making $20,000, $30,000, $40,000 a year. They may have $1,000 or $2,000 in the bank, and then they're in for an operation, and that's you see bills of hundreds of thousands of dollars.
Do we owe them, though, the operation? Do the people that are making more money owe them morally?
Do you want to live in a society where somebody is rushed to the emergency room, they open the wallet, there's no Blue Cross card, and they just throw them out on the street?
No. I don't want to live in that kind of society. But I don't want to do blanket
pay for that coverage if that.
I don't want to do blanket.
If that person, under the present system, under the way you want it, that person is entitled to get health care when they show up at the emergency room and they urgently need it. And they are now, and that's an entitlement that's a physical reality, even if it's not in the law.
All right,
hospitals don't turn people away.
We appreciate it. Always good talking to you. And coming next.